Hello, my name is Cynthia Patton. I am the chairperson of the WattsHealthcare Corporation. WattsHealthcare was started over 40 years ago by community members like yourself. As you can see, our corporation has grown and our service to the community has grown as well. We'd like to thank you for taking this opportunity to listen to our story.
Well, in 1967 and prior to that, people who resided in the community called Watts had to travel to County General or to Harbor General in order to seek, health care.
The lack of health care was one of many hardships the close-knit community of Watts had to endure. It fanned the flames of the Watts Rebellion, and it was the catalyst for the creation of the South Central Multi-Purpose Health Services Center. Moving into this building in 1979 was a huge event for the health center and for the community. We now had a permanent structure, which we never had before. It was blessed by then Mayor Bradley, and all of the political community were knowledgeable and supportive of our efforts. They were all on hand, to keep this phenomena growing. The organization quickly grew and at its height reached patients from Los Angeles, San Bernardino, and Riverside counties through its HMO, UHP Healthcare. What was important were the number of lives that were entrusted, to the delivery system. Not only were we focused on serving the Watts community and the surrounding communities, because people all over Los Angeles came to Watts for services. In 1974, the name was changed to the Watts Health Foundation. And in 1979, the state-of-the-art facility was built, and we called it the Watts Health Center. And as I said, Watts Health Foundation grew to become the 12th largest HMO in the state of California in the 80s. Fast forward to 2001, when the HMO side fell on hard times. The State Department of Managed Care ordered Watts Health Center to split from the HMO UHP Healthcare. And that was devastating. I mean, if you had been here all those years and you knew all the stages and phases of growth that we had gone through, to be reduced to that was a tremendous blow. And in order to continue to serve its patients, the Watts Health Center emerged from the conservatorship, having to start all over again with William Hobson at the helm.
My name is William Hobson. I'm the president and CEO of the WattsHealthcare Corporation. What I found was an organization with a lot of history, with a staff that had been around for quite a while, and through some very tumultuous times. When we took over, we had no money in the bank, but we had $2 million a month in cash flow needs. We had no agreement with the bargaining unit, so that there was no union agreement in effect. We had to get a new one. Nurses saw patients, doctors saw patients, the people who worked in social health programs, continued doing what they did.
I stayed because, for the community, since I was raised here in the community, and I like to help in the community. I had the opportunity to go to another health center, but again, since I enjoy working with the community, because the community is like a family to me. The patients that are here know me, so it's not just like an administrator to a patient. It's like a sister brother relationship, brother. So that's the reason I stayed here while we went into conservatorship.
It has been very helpful then that we didn't have to bring in new people, try to find new people, while we're trying to do the other things that were necessary to stabilize the organization.
And then post that time, we're able to see the fruits of what it is that we've developed. We were able to maintain a lot of the services, and then we've grown since that time as well.
So I'm happy to report that basically we've been able to move forward to purchase all of those facilities. And that was such a fantastic relief, because with that we're able to control our own destiny.
This is the area where patients first interact with our system. They come to the information desk. Most patients are directed to the customer service area. This is our customer services relations department. In this area, our patients come and they're interviewed by one of our specialists. We have a number of specialists here to serve our customer population. So this is a first stage in our delivery system. Jose Juarez, who's the department chief for customer services. In the same area as customer services, we have the billing unit. The billing unit is manned by these 4 ladies. They're very important to us because they're responsible for seeing to it that the billings are coded properly, that they're dispersed to the proper payers, and they keep account of monies coming in.
We start off with having primary health care services that include adult medicine, obstetrics and gynecology, pediatrics, and then other services including dental and a full source dental with some specialty in dental, and also urgent care to make it available for patients on the weekends and evenings. We have optometry and ophthalmology. Physical therapy and podiatry to help cover some of the major ailments that patients get over time with some chronic conditions. Maternal and child health program. HIV, AIDS programs, and a preventive health program. Putting all those elements of the programs together, that helps us to create a comprehensive program that's able to address some of the needs that we have in the community.
The goal of WIC is to prevent pregnancy complications, decrease iron deficiency anemia, help prevent the obesity problem we have, to promote breastfeeding.
I'm a health educator for tobacco control program. So what I do, I'm out in the community and I educate our community, Hispanic and African American, and as far as the health effects of smoking.
Good morning and welcome to the Magic Johnson School-Based Clinic at Jordan High School. And I want you to see our clinic and actually see where we perform miracles in a real small space. This is our nurse's office here. And we have 2 small exam rooms and our second exam room. And this is our small laboratory area. We're going to go up to where we perform our mental health services. We have students that are just feeling lost, feeling not loved, not wanted. We take that diamond in the rough and we polish it.
Hi, I'm Wendell Carmichael. I'm the Director of the Substance Abuse Division of the WattsHealthcare Corporation, the House of Uhuru. We're going to take a quick tour of the house. We actually are funded for approximately 67 clients. Out of the 67 clients, approximately 32 of them are men and the other 35 are women. This is actually our computer room, computer lab. As you can see, it's a full-service commercial kitchen. For the last 30+ years, know Mr. Banks, they respect him and appreciate him, and he does a great job. We have our Youth Education and Prevention Program. This is Sarah McLean, and she's responsible for oversight for all of our education and prevention programs.
My name is Lorraine Johnson. I'm the LVN Clinic Coordinator here at the Crenshaw Community Health Center. This is Dr. Karishi. She's our pediatrician. Hi. Dr. Karishi's been here for about 30 years. Almost. This is Ms. Callie Anderson. She's one of our LVNs. This leads over to the adult medicine part of the
After she goes in, you go.
So you just use a shot. Okay. I just want to tell her I called downstairs. Then when you sign, excuse me, I called downstairs to Tylenol.
Are you okay?
Okay. All right.
Well, the healthcare industry has a way of getting tougher each year than it was the year before. And so what we have to do is to try to make sure that we're prepared for tough times ahead. We have to make sure that we meet the needs of the community. Even people who are on the Medi-Cal program have a choice of providers. With respect to that, we have to make sure, first of all, that we continue to be a caring, sensitive, courteous organization to all of the people that we serve. We have 1970s facilities, and we have a lot of modernization and updating to do. We're looking at the possibility of adding 2 wings on our facility. We are starting a fundraising project to that end, and we hope to basically be able to make this facility a much more functional facility than it has been in the past. So what I'm hoping is that we can improve every one of those things as we go forward into the future to make an ever increasingly larger impact on the health needs of the community. Watts had the reputation of being just the living in, one of the best organizations, one of the best run organizations, one of the best clinical programs of its type in the entire country. I really want to see this organization succeed. I want to see it turn the corner. I want it to regain its former glory. And that really is part of my own vision for this organization.
The mission of the WattsHealthcare Corporation is to improve the health and well-being of the people and communities that we serve by ensuring access to compassionate, quality, culturally sensitive, preventive, and primary healthcare services.